What's up, you guys? It's your boy Miguel giving you your daily dose of radiation. In today's video, we're covering the precautions you have to take as X-ray tech when they're doing CPR. Mainly on your circuit board, your little X-ray board, especially if it's not a trauma bed. So to give you context, I'm a night shift X-ray tech, been doing it for 4 years, work a lot of day shift. When they do compressions, and your board is underneath it, depending on how much force, it will get cracked. The board can get damaged, it can be fixed. So if they're like, we're about to begin compressions, it's a trauma bed. If it's a trauma bed, you're okay, because the board's underneath. No matter what they do, it'll be safe. But if it's laying under the patient and they become compressions, your responsibility is to get that X-ray board out as fast as possible. Because sometimes they'll place the little, like it's another like thick board, like the CPR board, and if it's either below it or it's above it, it will still damage your cassette, like your little board. So your responsibility is always to remove it. I mean, they do, certain places, they'll have like a little grid cover for your X-ray machine so it doesn't get hurt. But even then, it could still get damaged or warped, and it costs a lot of money to get that stuff fixed or to get replaced. So that's the number one thing. You always have to be careful. And another thing, just being X-ray tech and seeing people get compressions, ain't nothing more scarier than they just get a patient stable, and then the doctor's like, oh, let's do a chest X-ray. And you have to move the patient, put your board, because you'll have to remove the CPR board that's underneath the patient so you can put yours so it doesn't get damaged. Ain't nothing more scary than doing that, because depending on how long this patient coded for, all the nurses are tired, all the nurses and everyone's like looking at you as you're like moving them to get a chest X-ray. It is very, very daunting to be, especially post. Like if they've already been like post code and they're like fine and stable, but like if they're making you do it like right after, everyone's like on caution, because it is very scary. Because like they could literally, as you're placing the board, they be monitoring the patient, and they'll see that he's coding, and then they'll begin the compressions again. Like I've seen it where it's been a cycle, especially in the trauma room. I've been thankful enough that especially if it's a trauma bed, it will literally be, you have a tiny window to get your picture done, because everyone got to step out, or the ones who don't step out, you have a second to just shoot it. And you better hope to God that the board didn't move, that the patient's in the right position, or that everything lines up, so when you shoot the picture and you get that small window of chance, it's actually there and you didn't clip it. Because sometimes they'll intubate the patient and then they'll start coding, so their main concern is there pneumo? Is the position of the tube correct? So I would say try to focus on the top part, because if you clip the bottom, you'll still be kind of okay. You may have to later on shoot another one for the rad, depending how bad you clipped it. But you want the top part, because usually they're looking for that. But once again, you'll always want to have the whole thing, but majority of the time you're always kind of scared, because sometimes you don't have another chance to shoot another one, because sometimes the patient, they have too much stuff going on, the nurses and stuff like that, for you to keep on radiating them. So it's something to keep in mind when compressions and stuff like that. And yeah, it's been your boy Miguel. See you on the next one.